GPRA reporting for the MI-PHL SBIRT grant, presented by Samantha Singer and the Wayne State University Evaluation Team. For more information, you can visit mygiprainfo.org and email any questions to bb0903@wayne.edu. What is GPRA? GPRA is an acronym that stands for the Government Performance and Results Act. It is a federal requirement of all treatment programs that are funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA. GPRA are basically a set of surveys that are given to patients to track their outcomes over time. It's a way to measure the effectiveness of federally funded programs to make sure they're working. And they do this by looking at how patients are doing before, during, and after receiving services. GPRA data must be captured on all patients who receive SBIRT services as part of the Michigan Promoting Healthy Lifestyles, or MI-PHL grant. Who should conduct GPRA? Any clinic staff can conduct GPRA surveys with patients. There's no special certification they need to have or anything like that. Where is GPRA reported? There is an online platform called Qualtrics, and this is where the clinic will enter all of the patient survey answers. There is one link that will be used for all GPRA surveying, and once that data is entered into Qualtrics, the Wayne State Evaluation Team will then enter the data into the federal reporting system called SBIRT. Why is GPRA so important? Again, GPRA is a federal reporting requirement of all treatment grants funded by SAMHSA. But on top of that, for the SBIRT project, GPRA will be the only measure of a clinic's performance that we have to look at, and the only way to gauge how well each clinic is implementing SBIRT. Patients that receive SBIRT services may be required to complete a GPRA survey at up to 3 time points. The surveys that they are required to complete will depend on the SBIRT service they received, and we will get into that more coming up. For now, the 3 types of GPRA surveys are intake GPRA, completed on the first day of service, discharge GPRA, completed on the last day of service, and 6-month follow-up GPRA, completed by Wayne State approximately 6 months after the patient's intake GPRA. Summary of SBIRT service levels. Here we have an upside-down triangle, and this is meant to be a general representation of how many people will require each level of service. So at the very top we have screening, because every patient will be screened. Only patients that have a positive screen will need to proceed to have a more thorough brief assessment. Patients who score in the low, moderate, or high risk range on the brief assessment will qualify for an intervention. The intervention they receive will be determined by their brief assessment score. So if they had a low risk score, they will be assigned to a brief intervention. A moderate risk score will be assigned brief treatment, and a high-risk score will be referred to treatment. The GPRA requirement corresponds to service level. So generally, the more intensive the SBIRT service, the longer and more in-depth the GPRA survey required will be. And when you're determining the GPRA requirement, you only want to look at the highest level of service that a patient received. So, for example, if a patient receives an intervention, they will have had a screening and a brief assessment first, but you're only going to look at the highest level of service when determining their GPRA requirement. So they would get the level of GPRA that corresponded to that specific intervention that they received. Here we have a flowchart that is looking at SBIRT service level, and it's tying in which GPRA surveys are required for each level of service. So we're going to start at the top in blue with screening. Every patient will be screened with a 1-question alcohol and 2-question drug screen. If they screen negative, no further service is needed. Their service level will be screen only, and they will require an intake GPRA. If their screen is positive, they will proceed to a brief assessment. A brief assessment is a more in-depth tool that's used to assess possible drug or alcohol problems. If they score in the no-risk range on the brief assessment, that is considered negative. No further service will be needed, and they would require an intake GPRA. Anything above no risk on the brief assessment is considered positive, and they would proceed to an intervention. The type of intervention that they receive will depend on what their brief assessment score was. So if they scored in the low risk range, then their service level is brief intervention, and they would require an intake GPRA. If they scored in the moderate risk range, their service level is brief treatment, and they would require an intake and a discharge GPRA. And if they scored in the high risk range, then their service level is referral to treatment, and they would require an intake GPRA. Now you'll notice a couple other things about these bottom 3 here, which are the interventions that I'll go over. So first, looking at brief intervention and referral to treatment, which is the bottom left and the bottom right, you'll see that in parentheses by intake GPRA, it says with discharge built in. So this is because technically all interventions require both an intake and a discharge GPRA. But to make things easier for clinic staff for these 2 services, we were able to add the discharge questions onto the end of the intake GPRA and kind of combine them. So it's just to note that, but in practice, it's only going to be 1 survey, which is the intake GPRA, that will be administered for those 2 levels of service. And then last, you'll also notice that for these bottom 3, they also include a 6-month follow-up GPRA. So that's here to indicate that these patients are eligible to participate in the 6-month follow-up, and the follow-up will be conducted by Wayne State. So that's why it's not in bold, because it will not be the responsibility of the clinic. And we will talk about the 6-month follow-up in more detail here coming up. GPRA and SBIRT service level. The first part of this chart summarizes the GPRA surveys required for each level of service, which is the same information we just saw in the flow chart on the last slide. So screening and brief assessment in yellow each only require an intake GPRA, and then the interventions here are in teal. So brief intervention requires an intake GPRA, and those patients are eligible to participate in the 6-month follow-up GPRA that is done by Wayne State. Brief treatment will need an intake GPRA and a discharge GPRA, and they're also eligible for the 6-month follow-up. And referral to treatment gets an intake GPRA and is eligible to participate in the 6-month follow-up by Wayne State. And again, there's a note here that for brief intervention and referral to treatment, the intake and discharge GPRA have been linked. So the discharge questions have been added on to the end of the intake for these 2 services. So all the interventions technically require both an intake and a discharge, but for BI and RT, we have combined them, meaning at the end of the intake GPRA, it will automatically transition into an abbreviated version of the discharge GPRA. The third column addresses which surveys require the patient to be present. This is another thing we're trying out to make things easier for the clinics. So for screening and brief assessment, which will be the most common levels of service, the patient does not need to be present for the GPRA. Clinic staff can complete the GPRA for these patients based on their interactions with them and information from their existing health records. If the answer to a survey question is not known, there's an option called Information Unavailable, and that can be selected for any question, and it will be recorded in the system as missing data. 6-month follow-up GPRA. Wayne State University's evaluation team will complete all of the 6-month follow-up GPRA surveys. 6-month follow-ups are critical because comparing data about how the patient is doing at the start of services to 6 months later is one of the best ways to evaluate that service's effectiveness. And being able to document the services work by showing measurable improvements and that they're evidence-based is crucial for funding purposes. One of the federal funding requirements of this grant is that a sample of patients from each intervention type, meaning brief intervention, brief treatment, and referral to treatment, must complete the 6-month follow-up survey. Since this is mandatory, and to emphasize the importance of gathering follow-up data, Wayne State will provide $30 gift cards to patients who complete the follow-up survey as an incentive. Having Wayne State conduct the 6-month follow-ups is another new thing that we're trying on this grant. In the past, the clinics have been responsible for all of the GPRA surveying, and we're doing this to ease the data collection burden on clinics as much as possible and some of the potential stress they may feel over having to reach that required completion rate. So like we touched on, a sample of patients from each intervention must participate in the follow-up surveys, and 80% of each sample must successfully complete the 6-month follow-up. This is mandatory. It's a federal and a funding requirement, and it can be difficult to meet the required completion rate. With follow-up surveys, as you might imagine, locating and tracking someone down 6 months after they've completed an intake GPRA is not always easy, especially with a substance use disorder population. So Wayne State will be stepping in to work with clinics by conducting the follow-up surveys, but we've set this up as more of a partnership, and the clinic will still play a very important role in the process. Clinic staff's role in the 6-month follow-up. Just to briefly recap from the last slide, it is a federal requirement for this grant that a percentage of patients from each intervention type complete the 6-month follow-up GPRA survey. Wayne State will be completing all of the follow-up surveys, but reaching that required completion rate will be a team effort between each clinic and Wayne State's evaluation team. Participating in the 6-month follow-up is optional for each individual, but a sample of participants from each intervention type are required to complete follow-up surveying. The more individuals who agree to be contacted for the 6-month follow-up, the higher the likelihood the required number of follow-up surveys will be successfully completed. Higher completion rates reflect positively on the clinic and may be beneficial in terms of maintaining and securing future funding. During the intake GPRA, the clinic staff will inform eligible patients about the follow-up and explain the details, including the $30 gift card incentive that will be provided to them by Wayne State upon completion. They will discuss confidentiality with the patients, give them materials about their privacy rights, and have them sign a release of information if they agree to participate. If they agree to participate, one of the clinic's biggest responsibilities in this process will be to collect several reliable forms of contact information. Wayne State will be relying solely on the contact information gathered by clinics during intake to reach participants when it's time for the follow-up. Best practice is to collect several methods of contact for the patient themselves. The best methods of contact may vary with each participant, so there's an extra space along with email and phone number where you can put a social media handle or whatever is most applicable to that specific patient. It is Equally, maybe more important, to collect the phone numbers for 2 of the patient's close friends or family members. These should be people close enough to the patient that they may be able to reach them in 6 months. In general, the more ways to potentially reach the patient, the better. Some patients may be hesitant to provide friends or family's information due to privacy concerns. This is part of what clinic staff should address with them during the discussions about confidentiality. Patients should be informed that there are strict privacy policies in place in regards to contact information. And we'll be going into this more on the next slide, but friends or family's numbers that they provide will only be used if the patient themselves cannot be contacted. And if they are contacted, no personal information about the patient will be disclosed. There is a place in the intake GPRA to enter contact information for patients who agree to be contacted for the 6-month follow-up. If a patient does not consent to participate, then no contact information needs to be collected, and staff can just write the word refused in the contact information box. These are pictures of the contact information questions that you will see in GPRA. On the top left is the question asking for the patient's information. There is space here for their name, phone number, address, email, and one additional space for another method of contact. This could be a social media page or whatever is most relevant to that particular patient. If the patient does not want to participate in follow-up, you would just type refused into these boxes and the survey would continue. If the patient does agree to participate, you would also see the question on the bottom right. And here is where you would enter the names and phone numbers for 2 additional friends or family members of the patient. And these should be people that are likely to be able to contact the patient 6 months down the line. The 6-month follow-up and patient confidentiality. Protecting patient confidentiality is a priority throughout the entire GPRA surveying process, and we utilize a lot of different privacy measures to ensure that patient information remains secure. The data for all GPRA surveys will be entered into Qualtrics, which is a secure platform that uses dual-factor authentication and is HIPAA compliant. Patients also have the right to decline participating in the 6-month follow-up GPRA, in which case they do not need to provide any contact information. Each patient should be informed of their privacy rights and will give their informed consent if they choose to participate. Patients will sign a release of information that authorizes the limited sharing of the contact information they provide between the clinic and Wayne State. This enables Wayne State to use the information collected by the clinic to contact the patient for the 6-month follow-up. Patients will be provided with written materials outlining their privacy rights, detailing what information will be shared and the limitations to that sharing. These materials will inform patients that the release of information that they sign can be rescinded by them at any time. It is limited in size and scope, meaning it only pertains to the contact information that they provided, and that information can only be used for the purpose of reaching them for the 6-month follow-up GPRA. The release is also bound by time restraints, meaning it is only good until the end of what we call the 6-month follow-up window. This is the 5 to 8 month window of time after intake that's given to complete the 6-month follow-up. At the end of 8 months, the release of information will no longer be valid. Administrative discharge. An administrative discharge is a shortened version of the discharge GPRA survey. It is entered by clinic staff when a patient cannot be contacted or for whatever reason does not complete the discharge GPRA. Administrative discharges are filled out by staff and therefore they're missing a lot of the information that the patient could have provided by completing the discharge GPRA. The shortened discharge surveys built onto the end of intake GPRAs for brief intervention and referral to treatment patients that we talked about earlier are actually administrative discharges. and these ones were designed that way due to the nature of those services. For example, brief intervention is a one-day service, meaning intake and discharge happen on the same day, so that's why we combine them. An administrative discharge for brief treatment patients, however, is a very different situation. In these cases, every effort should be made to complete the full discharge GPRA survey with the patient first. Administrative discharges are not favorable. They can reflect negatively on the reporting agency. And this is because gathering discharge data is a key component to being able to evaluate program effectiveness. To gauge if services are working, a patient's intake data from the first day of service needs to be compared to their data after receiving services. So administrative discharges should only be entered as a last resort and avoided whenever possible. If there is any chance that a patient can complete the full discharge GPRA survey, that's ideal. But how do you know when an administrative discharge should be done? To make this easier, we've set some clear parameters for when to enter an administrative discharge. And again, for this grant, this only applies to brief treatment patients, since that's the only service that needs to complete the discharge GPRA. Clinic staff will enter an administrative discharge for brief treatment patients after they have tried 2 times to contact them without success, and they have had no contact with them for at least 30 days since the intake GPRA. On this slide, we have a table that sums up the different types of GPRA surveys, when they should be completed, and who is responsible for completing them. Intake GPRAs should be done on the first day of service by the clinic. Discharge GPRAs are done on the last day of service by the clinic. For this project, administrative discharges only apply to brief treatment patients and are done when the patient cannot be reached to complete their discharge GPRA. These are done by clinic staff, and clinic staff will enter an administrative discharge when they've had 2 failed attempts at contacting the patient and no contact with them for at least 30 days. 6-month follow-up GPRAs will be done by Wayne State University. These will be done approximately 6 months after the intake GPRA. There is a 5 to 8 month window after intake that is given to complete the 6-month follow-up. And it's not included in this chart since this training is focused on the material that's most relevant to clinics, but there is also an administrative follow-up. These will be done by Wayne State when an eligible patient that was selected for follow-up does not complete it within the allotted time frame. These are basically the same thing as an administrative discharge, but for the follow-up survey. We try hard to avoid these whenever possible, as they're missing the data we need that we would get from the patient completing the 6-month follow-up. And to achieve the 80% follow-up rate that we're required to reach, only 20% of eligible patients that have been sampled can end up with an administrative follow-up. Clinics can help avoid administrative surveys by building relationships with patients, keeping them engaged, and keeping their contact information up to date. All of these things can help maintain a high completion rate and minimize the occurrence of both administrative discharges and administrative follow-ups. This is a chart of the GPRA sections that are required for each level of service. Service levels are in gray, intake sections are in green, and discharge sections are in yellow. Brief treatment is the only service that requires a separate discharge survey. You'll notice at the top that screening and brief assessments require sections A, B, and H. However, section B on substance use can generally be skipped right through for these services, since these are patients who have indicated they have little to no substance use. At the bottom, you can also see how short the sections for administrative discharges are. These are the ones that we try to avoid, as we don't gain any data on how the patient is doing after receiving services. These include just 2 short sections that are filled out by clinic staff. And overall from this chart, you'll just notice that the number of GPRA sections that are required generally increase with the intensity of the SBIRT service that the patient receives. The GPRA survey in Qualtrics. There is one Qualtrics link that will be used for all GPRA surveys for the MI-PHL grant. It doesn't matter if it's an intake or a discharge, or if it's for a screening or a referral to treatment. You will use the same link for getting to Qualtrics to enter the data. The first section of this survey is the most important, and it needs to be answered really carefully. This is because the survey contains a lot of skip patterns, and the way the first few questions are answered will determine the questions for the entire survey. So the first section is where you will enter the level of service and the survey type, meaning if it's an intake or discharge. And then the survey will automatically populate only the sections and the questions that are required based on the information that was entered. We will go through these first couple questions in more detail in the next few slides, but first we have a couple tips for conducting GPRA surveys. Surveys must be entered into Qualtrics in full in one sitting. This is called the one chance rule, and it means that once you sit down to enter a GPRA survey into Qualtrics, it must be finished in that session. Basically, partial surveys are not able to be saved on this platform. Therefore, if you log out before the full survey is entered, you will have to re-enter it from the beginning when you come back to it. Also, GPRA data should be entered into Qualtrics as soon as possible after the survey has been completed. And most places have found that the best way to do this is by entering the patient's answers into Qualtrics while they're doing the survey with them. Every organization is set up differently, and this isn't always possible, but if it is, it's generally the most time-efficient method. The survey questions must be asked exactly how they are written. If a patient is confused about what a question is asking, you should read it to them verbatim once or twice and give them a chance to interpret it for themselves. If they're still really having trouble with it, you can paraphrase it slightly, but only after it has first been asked exactly how it is written. You are required to ask every question, but patients do have the right to refuse to answer. And you'll see in Qualtrics that every question will have refused as an answer option. So that's what you would select if the patient did not want to answer. And lastly, it's a good idea to familiarize yourself with the GPRA questions before you conduct your first interview. PDFs of all the GPRAs are available at mygiprainfo.org, and these are separated into service level and survey type, so you can see exactly what questions are asked for a brief treatment discharge or a screen-only intake, or whatever service you're planning on doing. Keep in mind, however, that these PDFs contain all possible questions. GPRA surveys contain skip patterns that tailor each survey to the participant taking it. So, for example, if a patient indicates in a question that they don't have kids, all the follow-up questions related to kids will be skipped. So the PDFs on the website contain every possible question, but in practice with a patient, the survey will generally be much shorter. Accessing the GPRA survey. This is the link to access the GPRA survey in Qualtrics. Again, the same link will be used to get to Qualtrics to enter the GPRA data for all GPRA survey types and all levels of service. You can also find this link at mygiprainfo.org under the MI-PHL tab. This website was designed to be a resource to clinics and provide information related to GPRA and the SBIRT grant. Lastly, there is a back button on Qualtrics, so if something is entered incorrectly, it is possible to go back and fix it. If for whatever reason this button does not function correctly, or after the survey is submitted, you realize there was an error that needs to be corrected, you can notify Wayne State staff by emailing bb0903@wayne.edu. If this does happen, you want to email as soon as possible to request changes. You will generally have 48 hours after submitting a GPRA via Qualtrics to email and request a change. This is because after the data is submitted to Qualtrics, our job is to then submit it to the federal system called SBIRT as soon as possible. In Qualtrics, at the end of each survey, you will see detailed instructions about how to request a correction for a GPRA survey that has been submitted. Here we have a picture of the website, mygiprainfo.org. On the top left, you will see what the home page looks like, and that orange square on the right is called MI-PHL Resources. This is what you would click to get to the page on SBIRT and SBIRT GPRA resources. And this page can be seen on the bottom right here. And this is where you will find the link to the GPRA survey. You will find this training as well as others, and PDFs of all the questions for each service level. Patient ID. In the very beginning of each Qualtrics survey, one of the first things that will be asked for is the patient's ID number. The patient ID will be a 12-digit number that will be assigned to the patient by the clinic. The patient's ID number will be used instead of their name as a way to track them as they go through the GPRA process while also maintaining their anonymity. Since the purpose of the patient ID is to maintain the patient's confidentiality, it is important not to use any identifying information when creating their ID number. So things like the patient's date of birth or social security number should never be a part of their patient ID. The ID number that the clinic assigns to a patient will follow them throughout the GPRA surveying process and should be used for any and all GPRA surveys that the patient completes as part of the MI-PHL grant. These next two slides go over the first couple questions you'll see in Qualtrics. These are some of the most important questions and will need to be answered very carefully because they will determine the questions for the rest of the survey. The first one you'll see is what was the highest level of service the patient received. The key word here is highest because GPRA sections required correspond to the highest level of service delivered to that patient. So again, we can use the example that someone who receives a brief intervention will have also received a screening and a brief assessment first, but we're only going to focus on the highest level of service, which in that example would be the brief intervention. If you're ever unsure of which level of service is higher, you can just look at this question because the answer options are in order from lowest to highest. So screening would be the lowest and referral to treatment would be the highest. GPRA survey type and date. If the patient's highest level of service was brief treatment, you will next need to indicate if you are completing an intake GPRA or a discharge GPRA. The survey date is required for all GPRA surveys, and for this grant, the only time that you would select no interview completed is if it is a brief treatment patient that was unable to complete the discharge GPRA and an administrative discharge is going to be entered on their behalf. Re-entry into treatment. The only time that a patient will need a new GPRA completed is if they return for service and receive a new service. So, for example, if a patient came in that screened negative and had a screen-only GPRA completed, returned for service, and at that point screened positive, and say an assessment determined they qualified for a brief intervention, then a new GPRA at the brief intervention service level would be completed. If a patient returns for the same service, they will not need a new GPRA completed. Each patient will only be counted once in each category towards the clinic's target service numbers. And throughout the MI-PHL SBIRT project, anytime a patient returns for service, the original patient ID number that was assigned to them should be used again. This concludes the training. You can visit mygiprainfo.org for information and more resources. And you can also email bb0903@wayne.edu if you have any questions or if you need further training or technical assistance. Thank you.